From the News Channel 8 studios, let's talk live with your hosts, Natasha Barrett and Melanie Hastings.
We're talking about sudden infant death syndrome, also known as SIDS. It's a very serious issue for billions of parents. It's been in the news before. And now we want to offer you some tips. It steals the life of millions of babies every year, but there are some things you can do to help prevent it. And for those tips, Dr. Toni Thompson-Chittams is here from TLC Pediatrics with tips to keep your baby safe. Hi, Toni. How are you?
I'm fine, and you? Thank
Good.
you for having me.
Yeah, you know, when you think about it, SIDS was in the news for a while because there were so many deaths, and it seems like the rate of the deaths have dropped, but it's still an issue, right?
It is certainly still an issue because parents are depending on extended caregivers who perhaps are not familiar with our current safe sleep practices at this time.
So, and I also read that SIDS happens more in the winter time. Why is that?
Well, we think perhaps because of a lot of respiratory viruses may be an issue.
Now, the biggest tip that parents heard when this was such a problem was, you know, always put your baby to sleep in the crib, nowhere else.
Exactly, exactly. The American Academy of Pediatrics recommend that the baby should be in separate but proximal sleeping environments, and you should avoid co-sleeping. And of course, when you place the baby in the crib, make sure that it is first and foremost a approved crib with a firm mattress with a tight fitted sheet. And certainly it shouldn't be any objects at all in that crib. No blankets, no sleepers, excuse me, no pillows, no blankets.
There used to be an issue with the bumpers and certain kind of bumpers that parents would get. Of course, you know, you have a baby shower, everyone showers you with all these cutesy things that go with your trend in the room. What about the bumper in the crib?
Well, currently the American Pediatrics just recently made a statement against those bumper pads because we know there is an association with asphyxia or suffocation, so you shouldn't even have bumpers inside of the crib.
Because anything could happen once you leave the room just for a second.
Exactly, and when you lay your baby down to sleep, make sure you don't overly dress them. A light hat, a sleeper, a light sheet, and the room temperature should be comfortable for an adult.
And I guess going back to the winter thing, we're talking about the house. There's usually heat on there.
Exactly.
What would be a good temperature for new moms thinking, gosh, I don't want to make this mistake? What's right?
A good temperature is between 70 and 75 degrees. And the baby has a hat and a light sleeper and a sheet.
Okay. Now, when you position your baby in the crib, always on the back. That was the big issue with the SIDS, right?
Always on the back. When I was a resident, it was back or side to sleep. Now we realize that side sleeping poses a risk. So the baby always should be on their back.
What about the stomach? I've seen that done before.
Well, you know, we want the babies to have tummy time, doing awake time and play time.
When they can play.
Exactly, exactly.
Okay. Now, we've talked about the bedding materials, and you said the mattress, so it's, you know, a firmer mattress. You also say to avoid soft bedding materials.
Correct.
Soft as in, you know, the sheet being softer or flannel, or what are we talking about here? We're just talking about the mattress on that. Okay. Let's talk about pacifier.
Yes.
Is that okay? Because that's usually what gets the baby to sleep.
Yes, 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 yes. As a matter of fact, there's studies that show that pacifiers perhaps may have a protective effect. So certainly offer your baby a pacifier. Now, if you have a breastfeeder and they haven't mastered the breastfeeding techniques, perhaps you want to wait 4 to 5 weeks before you offer that pacifier, but absolutely offer a pacifier at bedtime.
Your next tip is to keep your baby in a smoke-free environment.
We encourage women to avoid prenatal as well as postnatal smoking because that is certainly a risk factor for SIDS.
Next one that I thought was interesting, and I want to talk a little bit about this, is breastfeeding your baby.
Yes, yes. Breastfeeding, we know breastfeeding have great benefits. It affords a baby, it boosts their immunity because you're giving babies antibodies that will protect them against different respiratory viruses and GI viruses that first year of life.
a lot of women can't for some reasons, or it's just not able to come to them easily. Maybe their body isn't producing enough milk to breastfeed their baby. So if they hear this and think, I want to do that but can't, and now she's on a formula, does that mean, you know, she's at more risk for SIDS when I put her in the crib?
Absolutely not. The thing is, you want to create a safe sleeping environment for your baby.
So anything you can do beyond that. The numbers have dropped when you look at the rates of SIDS. They used to be higher. They used to be in the news a lot, and we'd hear about don't do this, do this. And parents had to adjust what they were raised with because, you know, grandmas did this, and the mother has to change what she said was fine when they grew up. But right now, the numbers have really plateaued. They haven't dropped. They dropped, and they just kind of stayed. Why?
Well, I think that we're doing a good job, a good public service job of really getting the word out how important back to sleep is. And, you know, I take it, I try to get those extended grandparents in to really talk about safe sleep practices with them, because they tend to also be very influential with raising that baby.
Kind of like I said, I did it this way on you, for you, and you're fine.
Exactly.
Yeah, that's hard to break.
Exactly.
Well, doctor, thanks for coming in here and helping us with these tips. Good to see you.
Thank you very much.
Up next on the show, it's babies on the brain, apparently, and find out what Hollywood couples are now expecting another baby. But up next, we're going to be whipping up some ghoulish fun with Mary Porter Green from the Curiosity Zone. Stay with us for that. In the meantime, check out our blog. It's on our website. We'll be right back.